This is an example of uses of a sensor to measure or collect data about moist. What we are drawing here is a wound. The skin is on the right and left, and the red is the blood, and on top of that the gray area is the things that we put down in the wound to create a healthy climate for cells to devolve. The blue part that you also see being drawn on top of the first one is the bandage that are actually sealing the environment close to the wound and keeping the possibilities of germs and stuff like that as low as a risk as possible for getting into the wound. On top of that we have the sensor. The sensor is able to collect the data of water or any kind of liquid coming through the bandage. If we imagine that a small blood stream is coming through the bandage, we can see it actually coming from downside the wound up and penetrate the bandage, then the sensor will register that liquid and send a signal to whoever is taking care of the patient about the barrier being penetrated by water, and thereby that the risk of infection is higher. The goal for this thing is to reduce the amount of cost to the hospitals, to being able for those people working with the patients to look at the bandage without taking any top bandage or clothes off the patient, because the sensor is pervasive registering these data. It can also be used in the municipalities where nurses working with patients with chronic wounds will be able to either by themselves take contact to the patient if the bandage is or the barrier is breached, or the patient themselves can get a signal telling them that they should change the bandage. We can also use it at the doctors that want to help their patient get faster recovery with the wounds. One of the main goals is to reduce the cost for these patients, but also to lower the risk of the infection.